Happy Friday, Baylor College of Medicine and friends of Baylor College of Medicine, particularly those in other states and locations. I want to say hi to Norbert in California, Mike Fish in New York. So what a week. I'm beginning to feel like Rodney Dangerfield all the time. I mean, I'm okay, but last week, what a week. And by the way, no respect. So now doctors we're being accused, of course, of using the coronavirus to make money. So I just want to remind everybody, we went over last week, we're not generating diagnoses of coronavirus. If you look at excess mortality, that's independent of diagnosis. We lead the world in excess mortality over the last 8 months. If anything, we're underestimating the amount of coronavirus deaths that we have. So instead of 230 million, if you look at it, we're probably a lot closer to 300 million. And just to give you some idea, the American Hospital Association reported financial losses from COVID-19 that were expected to top $323 billion. So the hospitals aren't making a lot of money. They're losing a lot. And by the way, we looked at our own revenue. Baylor College of Medicine, our faculty practice called Baylor Medicine, that was our revenue dropped like this, although I did figure out a way to make it look like we were making money. If you just flip the graph over, it looks like we're really doing well, but unfortunately, that was the number. And that's exactly why the CARES Act was passed, because we weren't doing so well, and it helped save a lot of hospitals from going under. So despite claims that we're using this pandemic to make money, that's just not true. Now, one of the things I wanted to mention is if there is a physician out there that knows how to make money off of COVID, please send your CV in. We would love to hire you at the Baylor College of Medicine starting tomorrow. So if you have that opportunity, just let me know. So let's go over the data for the nation. We are really setting new records. We're really not doing well. We have now hit over 100,000 cases per day. We are in the middle of a terrible resurgence nationally. If you look at where it's happening, this is a wonderful graph from the CDC. What it shows is the last 7 days. Where is it happening? It's happening in the upper Midwest and the Midwest. So that is where the big problems are really taking place right now in the country. And there's a very interesting phenomenon that is also occurring. And that is that early on in the epidemic, urban centers led. And even in April early on, and then July, around July 4th, urban centers were the dominant place where the epidemic was really on fire. It is now flipped, and it's more in rural cities, small towns. That is the areas really that are under assault right now. If you look at the state of Texas, we're doing better than the rest of the country. We are surging up, but we are going at a relatively slow rate. And most of our cities have done pretty well. Houston is actually doing okay. We are moving up slowly. We don't expect to have that giant surge that we had in July or around Memorial Day. And actually, we're anticipating that we will peak somewhere around in the middle of December. It will probably be somewhere, half to 3/4 what it was at the worst time. But El Paso is just continuing to skyrocket up. El Paso is a real problem. It's not clear exactly why. We think it probably has to do with the failure to adopt a mask order, plus multi-generational living is probably a problem. But El Paso needs help. We're working with some of the physicians there, hopefully, to try and get some help to El Paso. Now, in our local area, in the 9-county region from which we derive data at the Texas Medical Center, our reproduction rate remains above 1. It's about 1.1. That means we're not controlling the virus. The virus is continuing to expand in our community. We need to get that number under 1. And then test positivity, we remain under 5%, but it's been creeping up. Now it's between 4 and 5. It used to be around 3 to 3.5%. And then also, if you look at the total number of cases, if you recall, we've been trying to get it under 200, which is about 5 to 10 per 100,000, we continue to remain over 600. So we aren't out of the woods yet at all, and I think this is the best evidence. You can see that the weekly average is beginning to tick up. It has been remaining over 600 cases on an average daily thing for the last 2 weeks, and we've been trying to get it closer to 200. And then, not surprisingly, hospitalizations are beginning to tick up as well. We're now over 100 hospitalizations per day. All of this indicates that we are continuing to move upward. We're not getting to where we need to be. So it's frustrating, I know, for everyone. We're all tired of COVID. I think we've been tired of the election, but we're really tired of COVID. And my sister, of course, keeps asking me, when are we going to be able to walk around without masks again? And so, rather than just blow it off, I said, okay, what does it take to achieve a maskless society? And now, I'm not going to even spend any time talking about those two Stanford professors who want us to achieve it by letting everyone get sick. That's not the way to achieve herd immunity. The way to do it is through vaccines. And we're very close to having vaccines available. There are two coming on fairly soon. I think early in the first quarter of the calendar year 2021, we will begin to see vaccines being distributed. There's some understanding of the efficacy, and so there is a hope. So in order to get to herd immunity using a vaccine, the right strategy, remember that graph I showed, it depends on the R value. In highly infectious diseases like measles, where the R value is 10 to 15 to 18, you need to achieve 95% immunity within the population to prevent outbreaks. This one's less, where it's, the R value is between 2 and 3, and it would take about 60%, 65%. And last week we went through the calculations. That would mean 208 million people of the 320 million in the United States would have to be immune to achieve herd immunity. Let's make it even easier, because my sister wants it easy. So let's make it 60%. If we achieve 60% immunity, that would then get us to herd immunity, and we could go back to being normal again. Well, how do we get there? Well, we don't really know the true prevalence, how many people have already been infected, but let's say it's 20%. That's probably higher than it really is, but in New York, it's been around 15 to 20%. In some of the higher infected communities, around 20. Let's just say 20%. So we got to get to 192 million. That's 60% of 320 million people. Let's assume 20% are already infected. That means 64. So we've got 64 million people already infected. So all we need is another 128 million. We're on our way. We're going to do this. We're going to beat this. So how do we get there? Well, we've got a vaccine. So great, we have a vaccine. Well, there's a very interesting consumer report that asked how many people will actually get vaccinated if there's a vaccine. And it's less than 60%. But let's just assume, we're going to assume we can convince these folks. 60% are going to be vaccinated of those that are eligible. And if that's the case, 60% are going to be vaccinated. The problem is the vaccine is only effective 60% of the time. So if we take those people who can be vaccinated and then vaccinate them, 60% of them will accept it, and it will work 60% of the time. That will get us about another 101 million people resistant. Why isn't it larger? Well, remember, under the age of 14, there are about 60 million kids, and they are not eligible for vaccination. So when you take that 320 million in the United States and take away the 60 million children that aren't eligible, you're down to 260, and so we go 60% of those and 60% efficacy, you get to about 101 million. So we need 27 million more, because 101 plus the 64 gets us to 128, not to 192. So where's the another 27 million going to happen? Well, maybe we have we can convince 10% more of the people to get vaccinated. We go from 60 to 70%. That gets us another 17 million. We still need 10 million. So frankly, unfortunately, Janet, we're not going to get to herd immunity even with a vaccine. Now, it is possible that we will have the vaccines for kids will start being included in the trials probably in 2021, and maybe by the end of the year, we can get the 5 to 14-year-old children vaccinated, that will add the 14 million that's needed. So in the interim, we're stuck with masks. I just don't, for 2021, even with the vaccines, it doesn't make any difference. We are going to be wearing masks. Now, there's one giant assumption in this, and that is that we act as a homogeneous population, that everybody acts the same. Well, and we know that's totally not true. So there are going to be places that have higher than 60% adoption of vaccines, and there's going to be places that are going to be much lower than that. And you can kind of look at where are the places that are likely to have less vaccine adoption, and those are the states that have adopted non-medical exemptions for vaccines. And there's a heat map for that. And so there are plenty of states, Utah, Idaho, North Dakota, Arkansas, Missouri, Wisconsin, Minnesota, and Texas have adopted exemptions to getting vaccines. So those are the communities that are likely to be on the low end of vaccines and will not achieve herd immunity as much as the places that will have higher percentages of vaccines. Then you throw in, well, what are the areas and states that are least likely to adopt mask wearing? Well, not surprising. Here they are. They're Idaho, Montana, Iowa, Missouri, North Dakota, South Dakota. So it's not hard to see what's going to happen next year. We're going to have a vaccine, and there are going to be communities that adopt it, and they will achieve herd immunity in their communities. And there are going to be communities that are reluctant to get vaccines and are reluctant to wear masks, and they will continue to have outbreaks. And I can pretty much guarantee you those outbreaks are going to be exactly where the outbreaks are happening now, in the upper Midwest and the Midwest. So I hate to say it because my sister will get very disappointed in me, but it is unlikely that we are going to be able to walk away next year and without wearing masks. I think we have masks in our future until probably 2022, and hopefully we'll have vaccines that are more effective and more people will be taking them so we can actually achieve herd immunity the right way, not by letting everybody get infected and leading to 1 million more deaths and 10 million more hospitalizations, but actually having vaccines that will protect the country. So that's my little thing for this week. And I'd like to finish today with a bunch of shout outs. First of all, shout outs to the DeBakey High School students. As you know, it's a fantastic magnet school that we have been working with the Harris Independent School District to develop their curriculum. The students there decided their civic pride to bring out the vote, and were very instrumental in increasing the voter turnout in Harris County. Big shout out to DeBakey. And I want to do a big shout out to everybody who's gotten their flu vaccine. Really strong adoption of flu vaccines this year. Very proud of our community. And then the last thing is, thank God everyone got out to vote. It doesn't make any difference who wins an election. It makes a difference that we all participate in voting and being part of our democracy. So I know it has been the most turbulent week probably of the last 8 months, but we will get through it. We've gotten through it. We will get through it. And it'll be an interesting another couple of months. Have a great weekend, and I look forward to speaking with you all next week. Have a great weekend.